So, according to Carranza, a periodontal flap is a section of gingiva or a mucosa which is surgically separated from the underlying tissues in order to provide visibility and access to the bone and the root surfaces. So basically the main objective behind raising a flap is that there are some areas in the oral cavity which are not clinically visible or accessible to us unless and until we separate the overlying epithelium. Okay, so flap is basically nothing but it is a section of gingiva as well as the mucosa which we separate by giving incisions so as to provide better visibility as well as access to the underlying root surface and sometimes to the bone. Moving on to the objectives of the flap surgery, meaning that why do we need to do a flap surgery? So first objective is that we need to increase the accessibility to the root deposits. So as in the definition itself, we have made it clear that there are certain areas in the oral cavity which are not directly accessible to us. So for that purpose, we raise a flap so that we can have a better access to the root deposits. Right, so the second objective is to eliminate or reduce the pocket depth by resection of the pocket wall. So the soft tissue lining of the pocket needs to be resected out in cases of periodontal pockets, and for that we need to raise a flap so that we can better eliminate all the granulomatous tissue which has been accumulated in that area. The third objective is to expose the underlying osseous defects in order to perform a reconstructive or a resective surgery. So not only we are gaining access to the root but also to the bone. Therefore, in cases where there are any kind of osseous defects present, meaning that any kind of craters or any concavities, for that purposes we raise a flap so that we can see underlying anatomy of the bone and perform certain reconstructive or resective surgeries. Okay, so these are the three objectives of the flap surgery. To the classification of these periodontal flaps, so basically these flaps can be classified into three categories. So the first one is based upon the bone exposure, second one is based upon the displacement, and the third one is based upon the papillary management. So moving on to the first category, that is classification of flap based upon bone exposure. So it can be classified as either full thickness flap or a partial thickness flap. So in this figure, as we can see, that full thickness flap basically means that we are reflecting the mucosa as well as the periosteum of the bone. Therefore it is called as full thickness, as we are also including the periosteum of the bone. In the next figure, what we are able to visualize is a partial thickness flap. Basically it is the reflection of only the mucosa. Therefore, we call it partial thickness flap, meaning that we are not including the periosteum in our flap. Moving on towards the next classification, that is based upon the displacement. So it can be broadly classified as either undisplaced flaps or displaced flaps. So undisplaced basically means that we are not moving the flap away from its original side. मतलब जहाँ से reflect कर रहे हैं flap वहीं पे वापस suture करेंगे, उसे हम कहीं भी डिस्टेंट लोकेशन पे मूव नहीं कर रहे हैं. एज अपोज टू द डिस्प्लेस्ड फ्लैप्स, द नेम इटसेल्फ इंडिकेट्स दैट वी आर डिस्प्लेसिंग द फ्लैप. एज इन based upon that, now we can again classify the displaced flap as either apically placed or coronally placed or laterally placed. So apically placed basically means that after reflection of the flap, we are placing it apically, meaning that away from the crown or the coronal portion of the root. Hence it is called as apically placed flap. In case of coronally placed flap, we are advancing the flap towards the coronal portion of the root, and in laterally placed flaps we are basically just rotating the flap towards the adjacent teeth. Okay, we are just moving the flap to cover any defect which is just lying adjacent to our flap. So here's the diagrammatical representation of an apically displaced flap. So in the first picture, what we are able to see is the incisions. We will be studying incisions in detail in the upcoming slides. Okay, so for now just understand that these are incisions which are being placed in the figure A. In figure B, we are reflecting the flap. Okay, and the flap is also been dissected from the alveolar process. So basically it is a mucoperiosteal or a full thickness flap which we have reflected here. And in figure C, what we are able to see is that the flap is been moved to an apical direction, and then in figure D it has been sutured to the new direction, that is apical to its original position. ओके, फिगर ए में जो है इंसिजन देने के बाद वो फ्लैप काफ़ी ऊपर है, एंड इन फिगर सी हम अप्रिशिएट कर पा रहे हैं कि अब फ्लैप काफ़ी नीचे आ गया है, एंड इन फिगर डी नीचे लाने के बाद उस फ्लैप को अपाइकली हमने सूचर कर दिया है. सो बेसिकली दिस इज़ एन एग्जाम्पल ऑफ अ डिस्प्लेस फ्लैप. मतलब हमने उसकी ओरिजिनल पोजिशन से उसे डिस्प्लेस कर दिया एंड उसको रूट के पास एंड क्राउन से दूर देन सूचर कर दिया. या सो दिस इज कोरोनली प्लेस्ड फ्लैप. इसमें अगेन सेम प्रोसीजर है. फर्स्ट वी हैव टू गिव इंसिजन्स, दैट इज हॉरिजॉन्टल एंड वर्टिकल इंसिजन्स. वी आर रिफ्लेक्टिंग ईदर अ पार्शियल थिकनेस और अ फुल थिकनेस फ्लैप. आफ्टर रिफ्लेक्शन व्हाट वी आर डूइंग इज उसको उसकी ओरिजिनल साइड से डिस्प्लेस करके हम उसको कोरोनली प्लेस कर रहे हैं. ओके, सो figure A, B and C are basically showing you the clinical pictures as to how it is looking into the oral cavity. So in the first figure A is we are seeing the recession. Okay, we are measuring the amount of recession which has occurred. In figure B we are placing two vertical incisions which are also called as the releasing incisions, and in figure C we are placing the flap coronally, that is towards the crown. अब recession का case है, basically it means that the epithelium has migrated more apically so that the root becomes visible into the oral cavity. Now this may lead to sensitivity. Therefore, for treating the recession cases, we need to raise a flap and place it more coronally, that is towards the crown, to cover the defect. Okay, so this is what is a coronally placed flap means. Okay, and after we are placing the flap into the new position, that is more towards the crown, then we are again placing sutures over it. So this is the procedure for a coronally placed flap. This is usually indicated in cases of gingival recession because there is a defect which has been created due to the apical migration of the junctional epithelium. So moving on towards laterally placed flap. So the name itself indicates that we are reflecting the flap away from its position and we are positioning it adjacent to the original flap location. Okay, therefore it is called as laterally placed flap, meaning that अगर adjacent tooth में defect है किसी भी, तो हम normal tooth से एक section लेंगे, that is एक flap reflect करेंगे and फिर उसको laterally place करके suture कर देंगे. So these are the steps which are to be followed for a laterally placed flap. Initially we prepare the recipient side. Basically we use this laterally placed flap to cover gingival recession. Okay, अगर सिर्फ एक टूथ में या दो टूथ में gingival recession है and the adjacent tooth are healthy with adequate amount of attached gingiva, then we basically raise flaps from those like healthy tissues and then we place them laterally. So for that we need to first prepare the recipient side, मतलब जहाँ पे recession हो गया है हम वहाँ debridement करेंगे, root planing करेंगे. ओके, अगर visible है तो वो root oral cavity में most of the times होता ही है, and the severity then again depends upon the recession, the grade of recession which has been present. So after debridement then we'll raise the flap from the adjacent tooth, as we can see that in this picture. Okay, the red colored line in step 2 is basically the line of incision. Okay, first incisions are placed horizontal followed by vertical releasing incisions, and then in the adjacent step 3 we are seeing that the flap has been raised, and in fourth step after raising the flap it has been positioned to the adjacent tooth, that is laterally, therefore it is called as laterally placed flap. Now after placing the flap we place sutures, okay, to cover that defect. This is the procedure for the laterally placed flap. Now all these flaps, that is apically, coronary and laterally placed, are examples of displaced flaps as mentioned earlier. Out of this, in cases of gingival recession, we can either opt for coronally placed flap or a laterally placed flap depending upon the clinical condition of the patient, but we cannot do apically displaced flap, because apically displaced flap में हम क्या कर रहे हैं, हम flap को क्राउन से दूर लेके जा रहा है, मतलब वी आर डिस्प्लेसिंग इट मोर टूवर्ड्स द रूट. एंड जिंजाइवल रिसेशन में बेसिकली ऑलरेडी अपाइकल माइग्रेशन जंक्शनल एपिथेलियम का हो जाता है, जिसकी वजह से जो शिफ्ट हो जाता है वो डेंटो जिंजाइवल यूनिट टूवर्ड्स द रूट. हमें और उसको पीछे नहीं खींचना है. वी नीड टू कवर द डिफेक्ट दैट इज द रूट विच हैज़ बिन एक्सपोज्ड इनटू द ओरल कैविटी. देयरफॉर ऐसी कंडीशंस में हम फ्लैप को कोरोनली प्लेस करेंगे. पीछे तो नहीं लेके जाएंगे, हमको आगे ही प्लेस करना पड़ेगा वो रूट सरफेस को कवर करने के लिए. देयरफॉर इन केसेस ऑफ जिंजाइवल रिसेशन ईदर वी कैन ऑप्ट फॉर अ लैटरली डिस्प्लेस्ड फ्लैप or a coronally displaced flap. So moving on towards our last classification, that is based upon the papillary management. So this papilla is nothing but our interdental papilla. Interdental papilla is that papilla which fills the interproximal spaces or acquires the gingival embrasure between two adjacent teeth. So based upon that we can classify it as either conventional flap or a papilla preservation flap. So in this picture what we are seeing is a conventional flap, and the classic example for this is the modified Widman's flap. Okay, this is one of the most common flap which we use in perio. Okay, and this is also known as the conventional flap. Here we are giving the incisions also along the interdental papilla. Therefore the papilla is been severed here and we are not preserving this flap. Therefore it is called as the conventional flap. Okay, so the next flap is papilla preservation flap. So as the name itself indicates that here we are preserving the papilla, meaning that we are not severing the interdental papilla, we are preserving that papilla, yet we are reflecting the flap. So for this basically in the figure A we are giving the intracellular incisions. Basically these cellular incisions are placed around the circumference of the tooth, hence called as sulcular. Sulcular here means gingival sulcus. Okay, so intracellular along the circumference of the tooth, that is along the gingival sulcus, along both the facial side as well as the palatal and proximal sides. Okay, then we are pushing it through the embrasure with any blunt instrument. Okay, and then we are reflecting the flap. So we are not causing any damage to the interdental gingiva, we are just reflecting the flap from the attached gingiva. Okay, so here we are done with the flaps. Moving on towards incisions. Now incisions are very important. Basically incisions are given initially and then we reflect the flap. For any surgical procedure, correct placement of incision is a must. Okay, based upon incision only the other procedure can be adapted well. If incisions are improper, that means that there will be poor wound healing and other complications may also occur. Therefore incisions are of utmost importance. In perio we can broadly classify these incisions as horizontal as well as vertical incisions. So these vertical incisions are also called as oblique releasing incisions. Now why they are called as releasing incisions, we will seeing in the upcoming slides. So these horizontal incisions are further divided into internal bevel incision, crevicular incision and interdental incision. Okay, and vertical incisions are always releasing incisions, because after placement of this vertical incision we are completely separating the flap. Therefore they are also known as releasing incisions. So the figure A basically indicates the first incision, that is the internal bevel incision, which is given initially, which is then followed by the crevicular incision. Now this crevicular incision, as discussed earlier, basically is given along the crevice, that is along the gingival sulcus circumferentially. Okay, the third incision is the interdental incision. Okay, this is given along the interdental papilla in the conventional flap so as to reflect the flap. Now these three are horizontal incisions. Now after placement of these three incisions, then we move on towards placing the vertical incision, which is our releasing incisions. अगर vertical incision place नहीं करेंगे, so we won't be able to manage like rotate or displace the flap towards a distant direction. We need to cut off the flap completely so that we can remodel it or manipulate it. Okay, so coming to the internal bevel incision, now this is also called as the reverse bevel incision because it is exactly opposite to our classic gingival or gingivectomy incision. Okay, Therefore, it is also known as internal bevel incision, and the incision which we give in gingivectomy is the external bevel incision. Now, this can be asked as an MCQ. Therefore, you must remember that internal bevel incision is reverse bevel incision. Okay, so basically this is the most basic incision which is required for all the flap procedures. Now, what are the objectives of this incision? The first one is it removes the pocket lining. Okay, as we know that we are doing this procedure to eliminate the pocket, therefore this incision removes the lining of the pocket. It also conserves the relatively uninvolved outer surface of the gingiva. Okay, now if this gingiva, if we place it apically, what will happen is that it will become attached gingiva. We do not want attached gingiva. If already there is adequate width present, why would we need more amount of attached gingiva? In many of the cases it is not required. Therefore, this internal bevel incision basically conserves the uninvolved outer surface and therefore prevents the attached gingiva from forming. Okay, the third one is it produces a sharp thin flap margin from adaptation to the tooth bone junction. Now, margin of the flap should be such that it is or it can be adapted in a closed proximity to the tooth as well as to the root. Now, if irregular margins are present, we won't be able to adapt it smoothly. Now, if it is not adapted in a proper way, then what will happen is that it will directly impede the wound healing procedure. Okay, therefore this internal bevel incision basically produces a very thin margin which can be easily approximated onto the tooth as well as the root surfaces. So this is the diagrammatical representation of internal bevel incision. So basically in figure A, this internal bevel incision is given in order to reflect the full thickness or the mucoperiosteal flap, and in B figure the same incision is been placed in order to reflect the only the mucosal flap or the partial thickness flap. So this internal bevel incision can be placed either to reflect like the mucoperiosteal flap or only to reflect the partial thickness or the so moving on towards the crevicular incision, as I have already described that this incision is given along the sulcus, okay, or the crevice. Crevicular means क्या कि हम उसको crevice से दे रहे हैं, that is from the gingival crevice. So basically it is made from the base of the pocket to the crest of the bone. Okay, pocket के base से bone की crest तक हम लेंगे. See in this figure B we are seeing that दिस इंसिजन इज बिन प्लेस्ड. ओके, एंड जब हम इसको रिफ्लेक्ट करेंगे तो इसकी एक्सटेंड जो रहेगी वो पेडोंटल पॉकेट के बेस से तो बोन की क्रेस्ट पे रहेगी. ओके, सो दिस द अपर पार्ट इज नथिंग बट अवर पॉकेट एंड उसका जो बेस है वो बोन के ऊपर रहता है. सो इस इंसिजन की वजह से वी कैन कम्प्लीटली सेपरेट दिस पॉकेट फ्रॉम द अंडरलाइंग बोन. बेसिकली इट फॉर्म्स अ वी शेप्ड वेज विद द इनिशियल इंसिजन. हमने जो इनिशियल इंसिजन प्लेस किया था उसके साथ ये एक बेवल फॉर्म कर देगा. ओके, so our third incision is the interdental incision. So the name itself indicates that interdental मतलब क्या, दो दांतों के बीच में जो हमारी interdental papilla है हम ये incision वहाँ देंगे. Now in cases of papilla preservation flap we are not giving this incision. We only give horizontal, crevicular and a vertical releasing incision. Okay, so basically this interdental incision is used to separate the collar of gingiva that is left around the tooth. सो फिगर सी में हम देख पा रहे हैं हमने पहले जो दो इंसिजन्स प्लेस कर दिए उसकी वजह से क्या होगा, जिंजाइवा का एक कॉलर बन जाएगा. ओके, जैसे शर्ट का कॉलर होता है लाइकवाइज जिंजाइवा का भी एक कॉलर बन जाएगा. बट यहाँ पे हमें एक बात याद रखनी है कि जिंजाइवा अभी तक सेपरेट नहीं हुआ है, उसका बेस अभी भी लगा, मतलब बोन उसके बेस से अटैच्ड है. देयरफॉर दिस इंटरडेंटल इंसिजन इज यूज्ड टू सेपरेट दिस जिंजाइवा, ओके, दैट इज लेफ्ट अराउंड द टूथ. दो इंसिजन की वजह से निकल तो गया है जिंजाइवा बट वी नीड टू रिसेक्ट इट कम्प्लीटली. देयरफॉर दिस इंटरडेंटल इंसिजन हेल्प्स अस टू रिसेक्ट आउट दैट लेफ्ट आउट कॉलर ऑफ द जिंजाइवा. ओके, एंड इसके साथ पॉकेट के जो एपिथेलियम एंड जो ग्रैनुलेशन टिश्यू है वो भी सारा निकल जाता है. सो वी आर डन विथ हॉरिजॉन्टल इंसिजन्स. नाउ विल बी मूविंग ऑन टू अवर vertical incision. So as mentioned earlier, this vertical incision is also called as the ऑब्लिक रिलीजिंग इंसिजन, बिकॉज इस इंसिजन के बाद ही हमारा फ्लैप कंप्लीटली सेपरेट हो जाएगा टूथ से. इससे पहले हमने जो भी इंसिजन दिए वो सारे हॉरिजॉन्टल प्लेन में दिए थे. ओके, बट ये इंसिजन हम वर्टिकली देंगे, दैट इज पैरेलल टू द लॉन्ग एक्सिस ऑफ द टूथ. Okay, and this incision must extend beyond the mucogingival line and it should reach the alveolar mucosa so that it can allow for the release of flap to be displaced. जब तक हम फ्लैप को पूरी तरह कट ऑफ नहीं करेंगे हम उसे डिस्प्लेस नहीं कर पाएंगे. सो देयरफॉर vertical incision is very important in order to release the flap from its origin. Okay, so figure A indicates that so figure A is basically the incorrect way of placing vertical incisions. We should never place vertical incisions in a curved way or in any direction. Okay, it should be a straight line parallel to the long axis of the tooth. That is what figure B is indicating. Okay, it should be a sharp straight line. Only then we can expect a good wound healing. So here we are finished with our flaps and incisions. So these flaps are basically asked for a 3-mark question or a 2-mark question, and sometimes types of incision may be asked. So here we are done with the most basic and ground level of periodontal surgery. That is, we have seen incisions and flaps. Okay, so I hope you all have understood this. Thank you.